That natural supplement in your cabinet could kill you. I'm not being dramatic, I'm being honest. Right now, millions of seniors are taking herbal supplements, thinking they're safe because they're natural. But here's what the supplement industry won't tell you. Natural doesn't mean safe. After 60, your liver slows down. Your kidneys can't filter like they used to. And certain herbs become toxic. In this video, I'm exposing 4 herbal supplements that are sending seniors to the emergency room. And the number one supplement? It's been linked to sudden liver failure in people over 65. You might be taking it right now. Before we begin, tell me in the comments, where are you watching from? We're reading and replying to every single one. Here's the truth nobody wants to say out loud. The herbal supplement industry is a $50 billion business with almost no regulation. They don't have to prove their products are safe. They don't have to test for interactions. They don't have to warn you about age-specific risks. And seniors are paying the price. A 2022 study in JAMA found that over 23,000 emergency room visits per year are caused by herbal supplements. Most of those patients over 65. Your body at 60 is not the same as it was at 30. Your liver processes compound slower. Your kidneys filter less efficiently. Your heart is more sensitive to stimulants. What worked for you decades ago could be poisoning you now. In the next 15 minutes, we'll reveal the 4 most dangerous herbal supplements for seniors, ranked from risky to absolutely deadly. Every fact is backed by peer-reviewed research. Every warning could save your life. Let's begin with supplement number 4. Ginkgo biloba is marketed as a memory booster, brain food for seniors. Millions of people over 60 take it daily hoping to stay sharp. But here's what they don't tell you on the bottle. Ginkgo biloba is a powerful blood thinner. And for seniors, especially those already on blood thinners, this is extremely dangerous. Let me explain what happens inside your body. Ginkgo contains compounds that prevent blood platelets from sticking together. This sounds good in theory, a better blood flow, right? Wrong. When your blood becomes too thin, you can't stop bleeding when you should. A minor cut becomes a major problem. A small bruise turns into a massive hematoma. But the real danger is internal bleeding. A 2020 study in the Journal of the American Geriatric Society found that seniors taking Ginkgo biloba had a 38% higher risk of bleeding complications. Brain bleeds, stomach bleeds, bleeding behind the eyes. These aren't minor side effects. These are life-threatening emergencies. And here's what makes it worse. Most seniors taking Ginkgo are also on aspirin, warfarin, or other blood thinners. The combination is catastrophic. Your blood becomes so thin, even a minor fall can cause a brain hemorrhage. One case study documented a 68-year-old woman who took Ginkgo for memory. She fell in her bathroom, a minor fall, barely a bump. Within hours, she developed a subdural hematoma, a brain bleed that required emergency surgery. The doctors traced it directly to the Ginkgo-aspirin combination. But there's another problem nobody talks about. Ginkgo can trigger seizures in susceptible individuals. The seeds contain a compound called ginkgo toxin that interferes with vitamin B6. Low B6 can cause neurological problems, including seizures. For seniors with a history of epilepsy or stroke, this is especially dangerous. A study in epilepsy documented multiple cases of ginkgo-induced seizures in older adults. And here's the final blow. Ginkgo doesn't even work for memory. A massive 2008 study called the GM trial followed 3,000 seniors for 6 years. Half took Ginkgo, half took a placebo. The result? No difference in memory, cognitive decline, or dementia risk. You're taking all the risks with zero benefits. If you're over 60 and taking Ginkgo biloba, especially with blood thinners, stop immediately and talk to your doctor. St. John's Wort is the herbal antidepressant everyone recommends. Feeling down? Take St. John's Wort. It's natural. It's safe. Except it's not. Not for seniors. Here's why this herb is so dangerous after 60. St. John's Wort is one of the most powerful drug interaction herbs on the planet. It activates enzymes in your liver that break down medications. Not just 1 or 2 medications. Dozens of them. Blood thinners, heart medications, diabetes drugs, antidepressants, even cancer treatments. St. John's wort makes them all less effective or completely ineffective. Let me give you a real example. A 72-year-old man was taking warfarin for atrial fibrillation. His levels were stable. His blood was properly thinned. Everything was working. Then he started St. John's wort for mild depression. Within 2 weeks, his warfarin stopped working. His blood became too thick. A clot formed. He had a stroke. This isn't a rare case. It's documented in medical literature repeatedly. A 2019 review in drug safety found that St. John's wort reduces the effectiveness of over 70 different medications. For seniors taking multiple medications, which most are, this is a recipe for disaster. But the interactions don't stop there. St. John's wort can cause serotonin syndrome when combined with antidepressants. This is a life-threatening condition where serotonin levels become dangerously high. Symptoms include confusion, rapid heart rate, high blood pressure, dilated pupils, muscle rigidity, and seizures. Without immediate treatment, it can be fatal. A case report in the Journal of Clinical Psychopharmacology documented a 65-year-old woman who combined St. John's wort with her prescribed antidepressant. She developed severe serotonin syndrome and required ICU admission. And here's another danger. St. John's wort makes your skin extremely sensitive to sunlight. For seniors with thinner skin and slower healing, this means severe sunburns and increased skin cancer risk. One study found that people taking St. John's wort had a 50% higher rate of severe sunburn reactions. But perhaps the most dangerous aspect is this. St. John's wort can reduce the effectiveness of heart medications like digoxin and statins. Your heart medication stops working, your cholesterol rises, your heart rhythm becomes unstable. All while you think you're taking something natural and safe. If you're over 60 and on any prescription medications, St. John's wort is not an option. The risks far outweigh any potential benefits. Kava is marketed as nature's anxiety relief, a natural way to relax and sleep better. But for seniors, Kava is a direct threat to your liver. And I'm not exaggerating. Multiple countries have banned or restricted Kava because of its liver toxicity. Germany, Switzerland, France, Canada, all have issued warnings or bans. Yet it's still widely available in the United States. Here's what Kava does to your aging liver. Kava contains compounds called kavalactones that are processed by your liver. In younger people with healthy livers, this might be manageable. But after 60, your liver function declines by 30 to 40%. Your liver can't process Kava efficiently. The compounds build up, toxicity sets in. The result? Liver damage that can progress to liver failure. A 2020 review in the World Journal of Hepatology documented over 100 cases of Kava-induced liver injury. Many required liver transplants. Some were fatal. The scary part? The damage can happen suddenly. You might take Kava for weeks or months with no problems. Then one day, you develop jaundice. Your skin turns yellow. Your urine turns dark. By the time symptoms appear, significant liver damage has already occurred. One case study documented a 63-year-old woman who took Kava for anxiety. After 8 weeks, she developed acute liver failure. She required an emergency liver transplant to survive. The doctors confirmed Kava as the cause. But liver damage isn't the only risk. Kava can cause severe skin reactions in some people. A condition called Kava dermopathy causes your skin to become scaly, dry, and discolored. For seniors with already fragile skin, this can be extremely uncomfortable and slow to heal. Kava also interacts dangerously with alcohol and sedatives. The combination can cause excessive sedation, confusion, and respiratory depression. For seniors, this increases fall risk dramatically. A fall at 60 isn't just a bruise. It's a potential hip fracture, head injury, or worse. And here's something most people don't know. Kava can worsen Parkinson's disease symptoms. The kavalactones interfere with dopamine pathways in the brain. For seniors with Parkinson's or early movement disorders, Kava can accelerate decline. A study in movement disorders documented cases of Kava-induced Parkinsonism in older adults. The symptoms improved when Kava was stopped, but the damage had been done. If you're over 60 and taking Kava for anxiety or sleep, you're playing Russian roulette with your liver. There are safer alternatives. Talk to your doctor. But before we continue, if you've been finding this information valuable, hit that like button and subscribe so you don't miss more life-saving senior health tips. Now, let's move to supplement number 1, the most dangerous herbal supplement for seniors, and this is it. The most dangerous herbal supplement for anyone over 60. Comfrey. You might not have heard of it, but if you're taking herbal teas, topical creams, or digestive supplements, it might be hiding in there, and it could destroy your liver in weeks. Comfrey contains compounds called pyrrolizidine alkaloids, PAs for short. These are some of the most toxic natural compounds known to science. They cause a condition called hepatic veno-occlusive disease. This is where the small veins in your liver become blocked and scarred. Blood can't flow through your liver. Pressure builds up. Your liver swells. Fluid accumulates in your abdomen. Without treatment, it progresses to complete liver failure. And here's the terrifying part. The damage is often irreversible. Even if you stop taking Comfrey, the scarring remains. Your liver function never fully recovers. The FDA has issued multiple warnings about Comfrey. They've banned its sale as an oral supplement, but it's still available in teas, topical creams, and imported products. And people are still getting poisoned. A 2021 case report in Hepatology documented a 67-year-old woman who drank Comfrey tea for digestive issues. After just 3 weeks, she developed severe liver damage. Her liver enzymes were 20 times normal levels. She required hospitalization and nearly died. Another case involved a 70-year-old man using Comfrey cream for arthritis pain. He thought topical application was safe, but the PAs absorbed through his skin. Within 2 months, he developed liver toxicity. His doctors confirmed Comfrey as the cause. Here's what makes Comfrey especially dangerous for seniors. Your liver's ability to detoxify compounds declines with age. The PAs in Comfrey accumulate faster and cause damage quicker. What might take months to harm a younger person can destroy a senior's liver in weeks. And the damage is cumulative. Even small amounts over time add up. You might think you're being careful by using it occasionally, but each exposure adds to the toxic load. Comfrey also interacts with common medications. It can increase the toxicity of other drugs processed by the liver. Statins, blood pressure medications, diabetes drugs, all become more dangerous when combined with Comfrey. But here's what really makes Comfrey the #1 most dangerous supplement. There is no safe dose. None. Any amount of pyrrolizidine alkaloids can cause liver damage. The World Health Organization has stated there is no acceptable daily intake for PAs. Even products labeled PA-free can contain trace amounts. And for seniors with already compromised liver function, even traces can be harmful. One study found that 47% of Comfrey products tested contained higher PA levels than claimed on the label. You literally cannot trust what's in the bottle. If you're over 60, Comfrey in any form, tea, capsule, cream, or poultice, is absolutely off limits. No exceptions. The risk of permanent liver damage or death is simply too high. There you have it, the 4 most dangerous herbal supplements for seniors. Ginkgo biloba that thins your blood to dangerous levels, St. John's wort that destroys your medication effectiveness, Kava that poisons your liver, and Comfrey, the most toxic of all. These aren't scare tactics. These are documented medical facts. After 60, your body processes herbs differently. What's natural isn't always safe, and what worked when you were younger can be deadly now. Here's what you need to do right now. Go to your medicine cabinet. Check every supplement you're taking. If you find any of these 4 herbs, stop taking them immediately. Then call your doctor. Tell them everything you've been taking. Get your liver function tested. Make sure no damage has been done. Now I want to hear from you. Were you taking any of these supplements? Did this video shock you? Drop your answers in the comments below. We're reading and replying to every single one. And if this video could save someone's life, a parent, a friend, a neighbor, share it with them right now. Hit that like button if this opened your eyes to the hidden dangers of herbal supplements. And subscribe for more science-backed senior health tips that could save your life. Your liver will thank you. Thanks for watching, and I'll see you in the next video. If you have any questions or want to share your own experiences, feel free to leave a comment below. Thanks for watching.